Hi everyone, my name is Jillian and I am a registered dietitian and certified diabetes educator at Prince Albert Grand Council. You may have seen me around your communities before. I travel out to Wahpeton, Little Red, Montreal Lake, Shoal Lake, Red Earth, Cumberland House, and Hatchet Lake. I do a bunch of different activities such as presentations about diabetes, cooking classes, gardening, and also I meet with people one-on-one to talk about their life with diabetes and what we can work on to help them to manage diabetes. So I haven't been able to travel out to communities for a few months now because of the whole coronavirus situation. So I wanted to prepare a presentation for you today all about what is diabetes. So if you have any questions about the material I'm going through today, you can leave a comment below, or you can also send me a message over Facebook Messenger and I'll get back to you. And if you want to talk more about your specific situation with diabetes, we can also arrange to do a telephone appointment if you're interested. To understand what diabetes is, you need to know about insulin. So insulin is a hormone that's produced by your pancreas. So if we're looking at the diagram here, out of all these highlighted organs, this one at that top, that big one there, that's your liver. And to the right, underneath that pinky one that kind of looks like a kidney bean, that's your stomach. And nestled behind your stomach, there's that kind of lumpy yellowish organ, and that is your pancreas, and that's what produces the insulin in your body. So insulin is important because it's what controls the amount of sugar that's in your blood. And blood sugar, it must be carefully controlled to make sure that the body's working properly. If we have too much sugar in the blood, it can cause damage to organs, blood vessels, and nerves. Insulin is also important because we need to use sugar for energy. So that sugar that's in our blood, the insulin, is what makes it able for our body to use it. Diabetes is a disease where the body either it can't produce insulin or it can't properly use the insulin it produces. So in other words, diabetes is a disease that affects the blood vessels. And the goal of diabetes treatment is we want to protect those blood vessels. And how we do this is by maintaining a normal blood sugar. Diabetes is a chronic and progressive disease. Chronic means lifelong. So if somebody gets diabetes, it's a condition that they're going to have for the rest of their lives. And progressive means that diabetes, it gradually gets worse over time. We are able to slow the progression of diabetes, so you can slow down like how fast it gets worse, but we can't totally stop it. And unfortunately, right now, there is no cure for diabetes. Signs and symptoms of diabetes include frequent urination, being super thirsty, losing a lot of weight suddenly when you weren't really trying to, feeling weak, being really hungry. If you have any cuts or bruises and you find that they're just not healing very quickly, dry, itchy skin, and blurry vision. These symptoms happen as a result of having high blood sugar. So for example, if somebody's peeing a lot, it's because it's their body's way of trying to get rid of all that extra sugar that's in their blood. So the treatments that we do for diabetes to keep the blood sugars within that normal range, that will minimize all of these symptoms listed here. So it's important to note that people with diabetes, they're also at risk for getting a low blood sugar. So this slide is talking about what you might feel like if you have a high blood sugar, but the low blood sugars are also really important to remember as well. And somebody is especially at risk for getting a low blood sugar if they take insulin injections. If you have diabetes, it's super important to know how to recognize when you have a low blood sugar and how to treat it. Certain people have a higher risk of getting diabetes. So everyone who has 2 or more check marks on this slide here, they should be having their blood work checked at a lab every 1 to 2 years, just to see how things are going. So you're at a higher risk for getting diabetes if you're 40 or over. If you have a family history of diabetes, so for example, if your mom or your dad or brothers or sisters have diabetes, you yourself are at a higher risk of getting it. Anyone of Aboriginal, African, Asian, Hispanic, or South Asian descent. If you had gestational diabetes, so this means if you were pregnant and you got diabetes when you were pregnant, after you have your baby, you're at a higher risk for getting type 2 diabetes. Also, if you didn't have gestational diabetes, but your baby weighed over 9 pounds, you're also at a higher risk for getting diabetes. And people who have overweight or obesity are at higher risk of getting diabetes. So you'll notice from that list of risk factors on the last slide that a lot of these things are out of our control. So for example, we can't control how old we are. However, there are still things we can do to lower the risk of getting diabetes, and this includes healthy eating and physical activity. So, just trying to live a healthy lifestyle, regular screening for everybody who's at risk for diabetes. So, thinking back again to that list there, if you have 2 or more of those check marks, you should be getting your blood checked every 1 to 2 years. It's also important to get blood checked for diabetes during pregnancy and after you've had your baby. Breastfeeding has been shown to reduce diabetes risk in both moms and babies. And also, medications can be helpful for preventing diabetes. So for example, some people, their blood sugars are higher than normal, but they're not high enough to be classified as diabetes. So these people have a condition that's known as prediabetes. And prediabetes, it basically means you don't have diabetes, but it's very likely that you will get it in the next few years. So taking medications when you have prediabetes can help to reduce the risk for getting actual diabetes. So when we talk about physical activity, the goal is to aim for 30 minutes of activity 5 days of the week. So in total, that's 150 minutes each week. And these 150 minutes, they can include any kind of movement, like anything at all that gets your body moving. So that could be like walking or housework, shoveling, gardening, like anything at all that gets you moving. So this also includes like those TikTok videos everybody are making, dancing on the spot, playing with your kids. That's all included as physical activity. So I really encourage people to find something that you enjoy doing, whether it be, spending time outside, chasing after your kids, walking your dog. Just find some movement that you enjoy to do. Aside from lowering diabetes risk, physical activity also has a lot of other benefits. So having a better mood. People are generally happy after they've exercised. Having more energy, sleeping better at night. So improving some other health measurements. So physical activity is really good for your blood pressure, it's good for your cholesterol, and it can also help you out with weight maintenance or weight loss. So when somebody has diabetes, there are several things involved for them to take care of themselves. The first is testing blood sugar at home. So that's when you have those meters and you're poking your fingers and your meter is telling you the number that your blood sugar is. And these measurements are really important because they're what a healthcare provider looks at to know like how things are going with your diabetes. Taking medications and or insulin as prescribed is very important to treating diabetes, and also just having those regular healthcare appointments. And that can include having an appointment with somebody from the PAGC diabetes team. So again, we're not traveling right now, but we are taking phone appointments. So please reach out to us if you are interested in a phone appointment. So that's the end of my presentation today. Please submit any questions you have. Please feel free to be in contact. I've also left my email here, dietitians@pagc.net, as well as my office phone number. So have a great day, everybody, and thanks for taking the time to listen today.